So the Crisis Care Center's levy is intended to fill a gap in the services here in our community, critically needed behavioral health services, mental health, addiction, for those who are struggling on our streets right now, for those who are in jail but what they really need is treatment. In fact, for people who have behavioral health problems throughout every community in this county. We have no walk-in crisis clinic in King County, a county of 2.3 million people. There's no place you can refer yourself, that your family can bring you, that a human services agency can bring you. And that is utterly unacceptable. But even after the crisis portion is dealt with, you need a residential treatment bed, and we have lost about a third of our residential treatment beds over the course of the last 5 years. This place here, the El Rey in downtown Seattle, had 60 beds. It is closed for want of funding. As the federal and state governments over the decades have backed away, buildings like this have slowly declined, and so we are in danger of losing even more. We've had to rush in and purchase buildings like this to keep from losing even more beds. We're going to rebuild them. We're going to make sure that there's enough room for everyone, and we're going to bring in the workforce that's needed to really help people recover. Some folks will remember when there was a movement away from the large mental hospitals, it was promised that there would be community-based facilities. This is one of those kinds of facilities. The legislature some 40 years ago invested in creating those, but there hasn't been the reinvestment to build more capacity and to keep places like this going. And so this is part of helping people get from crisis to recovery to becoming self-sufficient again. And it is just a missing element right now, and it wasn't historically local government's job, but the lack of investment shows up in our streets. It shows up in our jails. It shows up in our communities, and we have to do something about it. There's no question that this is needed for the work against homelessness to succeed. You can build housing, and that is the most critical missing element. But if you don't have a place for people to get treatment, they're not going to be able to stick with that housing. They're not going to be able to start to reclaim their lives. And I think that people across the county and of all political persuasions agree that there is a behavioral health crisis going on. It's mental health, particularly coming out of the COVID crisis. Fentanyl use and people dying from fentanyl is a huge crisis across our region and nationally. And this is a way for us to respond humanely and directly to that challenge. It's costing us a lot more to have a lot of untreated behavioral health challenges in our community, in our jails and elsewhere. And it ultimately improves our quality of life. It improves the challenge on our streets. It improves the challenge in the criminal legal system with a lot of this property crime that's going on. We have to do this if we're really going to solve those problems. I do not know if it'll pass unanimously, but I know there's strong support on the county council, as there has been on our regional bodies that include all of our cities. The people, what I've found is that the people of King County understand this. Almost everyone knows someone in their family, a friend, a relative who has had a challenge with mental health or addiction. And they know that the help really isn't there right now. So if we can provide that, we're going to make life better for many thousands of people in our community and for all of our neighborhoods.
For more local news coverage, live and on demand, watch King 5 Plus. Download free on Roku and Fire TV.